Extenet, we know the incidence of grade 3 diarrhea was about 40%. And that was a trial where there was no prophylaxis. So in Extenet patients, basically the diarrhea was managed reactively and not proactively. With control, obviously the purpose of the trial was to try to figure a strategy that was effective at controlling diarrhea and decreasing the incidence of grade 3. And different arms have been tested. We have the loperamide only arm, which shows some efficacy. Then there was a combination with budesonide and cholestyramine, with some even more improvement in control of the grade 3 diarrhea. So there was a reduction that was more than 50%. Now they're looking at an escalation arm, which I think it looks the most promising out of all. We have been familiar with the concept of escalation with other drugs in the treatment of cancer. Some of the TKIs that are out there for treatment of renal cell carcinoma, even lung cancer. A lot of times we as clinicians find ourselves having to escalate, and I think it's going to prove to be a valuable strategy with neratinib as well. So again, there is different alternatives. I think in my practice, the use of loperamide aggressively has worked well, but I know I have other options, and I think the escalation option may be one that will allow us as clinicians to be comfortable, try to take away patients from having to have first couple of weeks are more difficult, and eventually get them on to complete therapy safely for the remaining 11 to 12 months.